Jason Pozner from Boca Raton, Florida, and we have our wonderful guests here from left to right, Carolyn Glicksman, who I've known for God knows how many years, right? From Bruce Springsteen land, right? Not too far. Right. And then new Bajaj from Oklahoma City. We've all been on these calls a million times. So really two world's experts, and we're going to address a very interesting question that came up on one of our email strings that we threw it back to PSC for discussion. So we have two of the foremost breast implant experts in the world here. So we want to talk about, we were just talking about our own personal experiences with getting the COVID-19 shot. And we addressed on one of these previous calls about filler swelling and things that were a possibility after some of the vaccines. But we had a question that came up about, is there any effect upon getting implants or having breast implants with the vaccine or the virus that you guys know of? One of you guys, take it to town.
So to date, I don't believe we have any evidence or reports of adverse reactions related to breast implants. And millions of women have breast implants. And a lot of physicians have breast implants, and obviously they're the first ones to have gotten the first 2 doses. And I have yet to hear of any adverse events related to that.
Yeah, I looked up, I just went through and wanted to see what were the adverse events. I mean, these studies went on, they went through all the phases that a clinical trial normally goes through. Everybody's afraid that this study was, these vaccines were rushed in any way. And I think that's part of the fear, is that we actually got a vaccine within a year, which is unheard of. But they did go through all the phases. They did look at all the adverse events. The age groups included women that were certainly in a group of women in the age group that could have received breast implants. And like Anu said, we have millions and millions of women in this country and around the world that have implants, but there were no adverse events that were reported. I mean, the majority of adverse events were really just local problems, arm pains, fatigues, and chills, things that you normally get after any influenza vaccine.
So, the question is, let's talk about our peer groups. There are many plastic surgeons who have breast implants. I haven't heard of any one of them who said, I don't want this vaccine because of risk of fillers or breast implant complications. Have you guys keep up with the women in plastic surgery groups?
Yeah, we do.
Yes, we're both, the women's group in plastic surgery is very involved and very active. And many of us have all had breast implant surgery or have fillers. And to a T, everybody I've spoken with has wanted to get the vaccine, and the fact that she has had implants or fillers has not deterred her from getting a vaccine. Yeah. And from my own personal experience, I have both breast implants and I've had facial fillers, and I've had both of my doses of the vaccine, and I wouldn't have done it any other way. I didn't have a second thought once the opportunity became available.
Right. That's exactly the point. The point is, would you not get, a normal vaccines when you go to travel? Say you wanted to go to different parts of the world and you want to start traveling. I mean, whether I took a cholera vaccine once, or you need a typhoid vaccine, or if you want to travel to any, tropical countries, you need vaccines. This has been going on for years. There's nothing that unique about this vaccine other than it was approved rapidly because there was such an urgent need.
So, one of the things is listening to you guys, you have to say, does this pass my smell test? Which is, would I do it or recommend it to any family member? Like we were talking before, I got my second dose today. I wouldn't hesitate to have any staff member, any family member. My mom's in a nursing home. She's between first and second dose. She has Alzheimer's, but I recommend that everybody get this. And I really think that the proof of the pudding's in the eating. We're doing it ourselves. So I heard about in California, half the firefighters didn't want to get it. They were offering incentives to them to get it. I'm like, to me, get this, because the risk of COVID far outweighs the risk of the vaccine in my book.
That's what I would agree with too. The stories I've heard about individuals who've been sick from COVID and the number of people who've had bad recoveries of COVID or even have experienced more serious issues such as death. There's no way I would want to experience that or have any member of my family experience that.
I mean, I heard of a couple of our peers were in the hospital. I mean, one of my buddies in Long Island was in the hospital for 11 days. One of our buddies in Louisiana, who you all know, was in the hospital. He just got out. He's doing fine. But like, you could have some serious problems with this. So my recommendation is, if anyone's watching this video on YouTube or the Plastic Surgery channel, really don't hesitate and get this vaccine, because again, the risks benefit, are higher than the benefits are higher than the risks.
The benefits of the vaccine far outweigh the risks of having COVID.
I think if we were to bring this back to talking about breast implants, you're going to have the group of women in the social media platforms that are going to say, but we don't know the long-term effects. And I think, just as I said before, it's truly no different than any other vaccine. If you've been I think I just saw one recently on somebody's page that said, it was Atlan from Paris, Michael Atlan from Paris, and it basically said, got polio? No, of course you don't have polio, because it's science, right? So it's basically that concept. What are the known and unknown risks, and how do they relate to breast implants? Well, obviously it hasn't been studied together, specifically this virus. But it works like any other, this vaccine. It works like any other vaccine. And I think that the social media groups, or where that question comes from, would be those women that are fearful of anything. They're probably in the anti-vaxxers who wouldn't vaccinate their children for measles. So if you're an anti-vaxxer, be my guest, don't get it, and you probably don't have implants either. But for those women who want breast implants, who are willing to believe the science and the science of the safety data on the devices, you want to also believe the safety data on the vaccine and put the two together.
For the Plastic Surgery Channel, please follow us on YouTube, and please go to theplasticsurgerychannel.com. Thank you all.